Hello, everyone, and welcome back to another episode of Dobbs streaming to you live on Saturday night. It's been a while, I know, but after this break, I think it's timely that we should really get started again. And I'm very pleased for a few things. Firstly, this is the first time I'm streaming to LinkedIn. So if you guys are on watching from LinkedIn, just give us a shout out there. And we're also streaming live on Dobbs Facebook group as well as YouTube. My special guest tonight is my friend, Dr. Ho Hon Bing, who is the head honcho at Teleme, and he's got a very interesting short presentation for you on digital tools for doctors in the 21st century. So without further ado, I'm going to bring Hon Bing on the stage now. Hey, welcome, Hon Bing.
Oh, thank you. Hi, Alan. Hi, everybody there and watching for tonight.
Yeah.
Thank you for inviting me to share with you all things that I've learned in my journey while developing this Teleme healthcare platform. And what I'm going to share to you, what I've built for our community. Shall I carry on?
Oh, yeah, carry on. Maybe we'll just jump straight to what you say first. Then we have a little chit chat after that. Yeah.
Yeah, thanks. I met Alan when we were working together in University of Malaya, and at that time it was really good. We learned a lot, and we really care for our patients. And at that time, handphones had just really come in, so it was very new for us. Then later on, when Steve Jobs introduced the smartphone about 2007, 2008, it really opened the world to every single person. So I got very excited, and Alan's also a digital nomad, and we really wanted to see how we can use technology in healthcare to really improve healthcare for our patients. And I developed this Teleme healthcare app, and our mission is really to optimize our patients' user experience with all the digital tools that really are now present. And the amount of tools are so many, it's just amazing. So I'd like to take you through a little bit of a history on the digital advancement in the last few years. In the past, we used to have our website, and that's where we would advertise our clinics and our services. But now it's all come down to inside a mobile app. Previously, we had to fill forms when you go to any office or even the clinics. Now, with a scanned QR code, you can actually fill in while you're waiting. And this has been popularized because of the My Sejahtera app, and so that there is actually less contact between you and actually the staff. And we realized that all of us took it in very easily because there was fear and we had to learn. And now QR code is part of normality. So even menus, things for you to read, you have to scan in and actually get it into your phone. And it's wonderful because you can actually take it home and read it through in your own sweet time. In the past, leaflets, like newspaper and things, were the norm. We used to wait for our newspaper. Now, everything is now online. And not only is the newspaper more exciting because it's really up to date, you don't have to wait until it's published the next morning. It's actually now multimedia. You get actual video footages, you get audio inside as well as text. So it becomes a very exciting form of delivering news and knowledge. Just not just to people absorbing the news, but also to students learning new things. Can you imagine if we had the anatomy Adam now, how much faster we could have learned our anatomy? It took me years, really to understand anatomy. The first year, I really couldn't understand it. It's only by the third year that I actually appreciate the three-dimensional parts of all the anatomy that we have, using the cadaver. Can you imagine now, using this video technology and 3D technology, how fast we should have learned our anatomy in our student days? Previously, we had to pay using cash, using credit card. That's about it, really. And the acceleration of online payment now, even to your income tax, is all through online because of, again, COVID. And it was impossible to actually go face to face with certain people, go even to the offices. And all the payment gateways are now available online, from the banks to even now touch and go wallets, so that the kids can actually have access to something that's safe, that they can pay online at their school canteen. So it's now permeated to the next generation down, and they seem to use it with such ease. And finally, I want to tell you this: the way we communicate, it has changed dramatically. In the past, we would call our friends, have a chat. Now, I'd like to ask you, when was the last time you called somebody physically in the daytime? Very rarely. We all communicate through messaging, and we laugh over jokes, we send each other messages, and only if it's necessary do we actually convert that message to actually a phone call. And that is how, in the last few years, we have adopted the technology without even realizing it. That is so amazing. Of course, our kids have taken this for granted. They definitely are using online payment and ordering things through the canteen, through the shops online, and through the bookshop. They had to buy their books online. Amazing, and order them, without a single cash transaction at all. Now, let me take you through what I used to do pre-digitalization. This was my old referral pad. I would write the name, patients, I write a little bit of history, and then from whom I was referring to, and then I also put a little map there so that they can find the place and can find the clinic number so that they can call. This was, a very common way of actually getting referral from friends or colleagues, or actually referring to your friends and colleagues. Okay. This was my own name card. I thought I was very clever by actually putting in a map so that they can actually find where I am. I also put my name there, and I also tell them what I do. And of course, the usual click. And you can also see some amendment there in ink because I've changed the time. But being so stingy, I didn't want to change the card, so I actually manually, updated it. But it does look rather bad. But there we go. And in the past, I used to give patient leaflets. I didn't want to give farmer ones because I didn't want to have any bias in what I'm giving. So I actually printed them myself, and I wrote them. I used to publish books, so I write them and put in my stuff. And it usually cost me, when I put a print run of about 10,000 leaflets, it will cost me $1, about around $1. The more you print, the cheaper it becomes. But every time I move to a new set of equipment, ophthalmology moves very fast. It means I have to throw away the old leaflets and then have to print a new set of leaflets for my patients. And that was very costly and actually very frustrating. Then when technology came, I thought, okay, I'm going to have a website. I'm going to have using the WhatsApp because it's a good messaging. Most of us now message. Put out my online social media into Facebook, Instagram, and then when I did interviews, I would send them my interviews. And if I did any corporate hospital videos, I would also send them to me. But they were all disparate. They were all from different places. And basically, they're not in one single place. They can go to your website, but they cannot see your BFM interview, for example. They won't be able to see your, let's say, your hospital promotional video because that will be in another website. So how do you actually put it all into one place? So that was what I was trying to develop Teleme for. Now, let me tell you, this is my old way of communicating. Why was there a nurse between me and the patient? Well, I didn't want them to know my private handphone number. If I WhatsApp and message a person, my handphone number will be visible immediately. So I have to do it through the nurse. The nurse will then WhatsApp them. Then the message comes back. Then she bring it back to me, and then da da da. Between me and a referring doctor or a doctor who's referring to me, we tend to message each other. They'll ask, "Are you free today? Can you see an emergency on my behalf?" And that's what we do. Then when it's done, then I'll get my nurse to contact the patient, and the patient then gets the nurse of the other doctor whom I'm referring to, and that's how it went. It was quite messy, okay? And also, I cannot see what is my nurse messaging to the patient. She will just basically screenshot, send it to me. I text back, screenshot back to her, and then she screenshots back and sends it to the patient. Very, very tedious just to do a form of communication. So hence I decided, okay, why can't we put all the technology together into one single app? So that's what exactly I did. So here, this app uses technology of messaging. So it's like a WhatsApp. Add as a video call is exactly like a Zoom. Um, Basically, I'm available 7 days a week, but the messages tell them that I will reply within 24 hours. My clinic is integrated into Waze and Google Maps, so I do not need to make a map. They do not need to know where it is by just click a single button. I'll show you later. If I was going to refer a case to Alan, I will just type online, and he will get the letter when he is when it, immediately. One of the things that used to bug me is whether Alan, someone have referred to, has actually read it. Now, I program it such that when Dr. Allen has actually clicked to read it, I will get a notification that says, yes, Dr. Allen has actually read your referral and accepted the referral. So therefore, I am now happy that my patient is now going to be taken care by the person I've referred to because I pass on now the healthcare to the other person who's now taking care for on my behalf. We also put in an online payment. Sometimes we do charge them before they come because some things you have to book in advance, like buying the intraocular lens. So we have to buy them before they actually come. In case they don't turn up, then it becomes wasted. And one of the key things here is the customer user invite. Everyone here gets a doctor gets a QR code where they scan, and when the invites the patient to actually download the app. Why was this done? Is so that there are some doctors who do not want their competitors to be seen in the same app, and we have programmed it that way. I'll show it to you later. So basically, it connects all the healthcare players in the same ecosystem so that the patients is able to talk into a single channel, the doctor, the specialist to whom the doctor has referred to, and if the GP, the primary doctor, has a nurse or a dietitian in their team, they can also be part of the healthcare journey for the patient. Then, so that the patient can actually get access to all of them through the single platform to actually deliver healthcare. As you know, healthcare is not just one single doctor, it's actually multidisciplinary. And multidisciplinary just doesn't mean medical, it may also mean nursing, a call out nurse maybe to do home visits for wound dressing, for example, changing of catheters because we are too busy to go out there to do small jobs like that. We may ask our nurse to go out and do that. Changing of dressing, besides just wound care. So there are lots of little things that they can do. Pharmacists, we mustn't forget our pharmacists too. They are a source of patients to us, as well as them being part of the healthcare journey. Because in other parts of the world where they're developed, they actually are part of the primary healthcare team. Here, because of there's no dispensing separation, so there's a slight separation between the two. Labs are also very important because our patients also go to the lab and they do get their blood tests done. And somehow the labs need to get the data back to us. So Teleme also connects the labs to the doctor. So this is what the single app does. It connects everyone together who is actually in the ecosystem. So how does the app look like? In Malaysia, it has three languages, as you can see here. It's simple. It allows, once you've signed up, for the patient to be able to see your clinic profile. Your clinic profile will have your address, will have your profile, biography. It will have your clinic opening times. It will have your map. It will have also what sort of treatment focus that you have, etc., which I'll show you later. It also allows your team members, because sometimes the doctor doesn't want to answer, they can actually pass it to the nurse or whoever, the manager, nurse manager who's in charge, to actually do the answering. Because it's an omni-channel, a single channel, if it's a very complex question, your nurse can actually ask you to log in and answer the question because we share the same message thread. So both the nurse and you can actually see the message that's going on between you and the patient, as opposed to having two uh, WhatsApp phones. Okay, you can't see what your nurse is talking to your patient, and your nurse can't see what you are talking to the patient. Here in Teleme, both the nurse and you are able to see what you are talking to the patient. So there's actually a continuous care thread, message thread. As mentioned just now, the online referral is very straightforward. You click directly refer to that person. When the doctor, like Dr. Allen, has actually accepted it, his clinic profile becomes visible to the patient. He doesn't need to ask for a map because the Dr. Allen's clinic profile will be visible to the patient, and including his directory, and which is then clinic map, which is actually linked to Waze and Google Map. So I've done for one shot, you do not need to give the patient a physical map. We also have online reminders. Online reminders are a very, very important source of continuous care, because when I ask a lot of doctors, I say, how do you communicate to that patient to come back for the yearly checkup or yearly blood test or maybe 6 monthly HbA1c? It's usually done manually, and sometimes if you are a bit busy or if you're not so efficient, they actually don't uh, get notified. And sometimes because they don't get notified, they might find another GP down the corner or another doctor near them. So you actually may lose patients without you knowing. There are also health articles that's called under health tips in three languages, which allows the patients to actually read deeper into it rather than going to Mr. Dr. Google and read unnecessary misleading articles. So you can actually share health articles that are actually professionally written by a group of us, and you can contribute towards the articles if you like, so that they can be shared out with the patients on this ecosystem. So let me share with you. So this is the profile page. It is almost like having your own website on the phone. So this is mine. So you can see what sort of services that this person specialize in. Is breast cancer. A little blurb there. Some things. Here there are some health articles that the patient can actually read. Yeah, so that they can share with them. Here, can you see? I click and there's the directory, and you can actually see it pops up and it gives you the directions to my clinic. So it's that easy for the patient, instead of having that map I showed you earlier on that they have to navigate by themselves. Here, let's say, for example, everybody keeps asking me how to apply eye drops. So I wrote an article on how to write eye drops. Here we are. They just click into it. It's so easy. There's a picture how to apply the eye drops. And they go down there. There's a video to teach them how to use the eye drops. So that really saves a lot of chair time for me and for my nurses, so that all the resources that are in for me are all available on this app on my profile page. and I can keep updating it. And remember, when I showed you just now, when I brought a new machine, I had to discard all the old ones away. No, you just need to just edit, and within 5 minutes, the new version of the article is uploaded at no extra cost. It's so amazing. That really saved me a lot of money. And also, sometimes there are new medications, and the old medication is no obsolete. I can just edit it, and the articles remain continuously up to date. And every time you update it, that it also says updated at such a date, so that the patients know how updated these articles are. There's nothing worse than going to a website where the article is written like 10 years ago and is completely irrelevant. In this day and age in medicine, anything more than 5 years old, any health article more than 5 years old is completely out of date. Here, this I'll just show you how messaging works. As I mentioned, messaging is really the way we communicate with everybody, including your friends, including your parents and your relatives, because we don't call them anymore. We actually message them. And this is the crux about our messaging with our patients and with our colleagues as well. So for example, here in the middle, this is the team leader, let's say in my center. So what will happen is they can actually message. He's asking here, how can I look after my hypertension? Now, it seems like a very simple question. The nurse can handle this, all right? The nurse can handle this because we already have an article on how to manage hypertension by themselves. Exercise, diet, relaxation, and less stress. So that article is already written. So nurse can handle this, doesn't need to escalate to the doctor. So let me just show you. So this is what happens. They say this is the thing. Here it passes this article. There we are. Here, how do I need to help keep the article properly? There's some videos there as well. There's the management here. Then lifestyle changes. On each of these colored ones, that leads you to another article here. For example, it says here, the exercise 75 to 150 minutes. When you click there, it shows you the kind of exercise the patient can actually do. So one article leads to another. Then he wants to learn about the DASH diet. He can click and he looks at the DASH diet. The DASH diet helps them to calculate the amount of salt in each of the popular foods in Malaysia. So, however, if he asks you a very difficult, complex question, then this nurse manager can actually escalate to you, the doctor, who then can actually join in the conversation and continue the conversation with them. So it's actually very efficient, and it gives your front end staff also some job to actually manage your patients together. Everybody thinks digital health is about actually teleconsultation using video call. In fact, it is the least used. Video call is the least used on Teleme. Let me tell you that. They only use it are counselors who are like the psychologists, okay? Because that's how they treat patients. Very rarely do we need to do a video call. Most of the time they will chat, unless of course they want to show me something like visually, something like a skin, something like the eye. They will do escalate to the video call. The good thing about our video call is that we program it in such a way that you can actually have a PDF copy of the consult summary that you can be shared with the patient, so that the patient can actually keep it as a form of record, and you too can keep it as a form of record, which can be downloaded and actually printed out. And in case you are still using paper records, you can actually slip it in so that it's already time date stamped, so that you can actually say that I've had a video consultation with this patient. Finally, when we do how do you bring patients up on? Like I said, the QR code is very straightforward. You scan in the QR code. Once the patient sends the QR code, you will then download the app from the App Store. But how we program it is that they will only see your clinic with your clinic logo. All right. If you have your website, we can have a website, your logo website, or if you have an e-commerce store, you can actually link that to your thing. So now this little app now becomes almost like your own website, mobile app site, without having to pay for the development of it. All you need to do is to subscribe to it. Let me show you how a patient would scan. Look, when he scans in, it goes into the website. Okay, the magic is into the QR code, which automatically detects Mr. Center XYZ. So it's only from Mr. XYZ, not from any other doctor, not from Dr. Allen, not from Dr. Ho, not from me. So once it's detected, the patient just fills in 4 items: the name, the email, the handphone. We need to have the handphone because it's a mobile app. And then just clarify the password twice, and that's it. Okay. And what's so special about it is once you have done this, your patient actually gets an automatic welcome message from you, and this welcome message can be edited by you yourself. Okay, just watch. So here it goes. You get a little, once you download the app, there's a little notification just coming up here. Patients then clicks there, and you can see welcome to from you, and it's from you. It's very personalized from you. So it's a very, very personal thing, and you don't even have to do anything. They just you just get a welcome message, and you already start the conversation, and that's it. Um, and this is basically the app in totality. There's a lot more into it because I haven't told you about the connection to the pharmacy. I haven't taken connection to the laboratory, where there's path lab, where you can actually get the reports sent to you online. Before I finish, I like to go through this. Why bother connect with patients? A lot of people ask me, I don't need to connect with patients because they come to see me because I'm very famous and I'm very good. Well, when Dr. Allen and I started 20 years ago, I think probably there were less than single digit hematologists in Klang Valley, correct? Had very few GP practices, very few specialists, very few oncologists. I just did this today. I just wanted to see what's the list of GP clinics around Bangsa. On your left, it's all the GP clinics around Bangsa. And on the right, it's all the pharmacies around Bangsa. Can you imagine? I'm standing right in the middle there, how competitive it is. And because everyone here is really very impatient, I know, if you're not reachable, you're not accessible, I think they'll just walk next door. And here is the time where really service is of very important. People connect to you because you provide better service. To them, unfortunately, medicine has actually been commoditized to a certain degree, which is rather sad. But we can actually rise above it by adopting technology, making sure that we don't fall behind with all the other industries. What do you mean by all the other industries? Look at F&B, look at other banks, even education. Everybody has some form of online. They've gone hybrid. There is online and offline. So we really have to come on, otherwise we're completely left behind. You can actually see the number of actual clinics that have closed, and you also see a number of F&B that have closed. But the ones that have thrived and have exceeded is the ones that have a hybrid model. During the lockdown, they delivered because they have an online presence. Those doctors that had online presence, they did lots of things that I didn't really know, like PCR testing, vaccinations. They were accessible because at that time nobody knows where or who is open. But as long as you have an online presence that you offer this kind of services, you are around, you are contactable, you have business. And unfortunately, it comes down to this. The next thing is about the reminder. Now, reminder actually is very, very important. We tend to forget that, in like 20 years ago, my GP friends, they were seeing like 60 to 100 patients a day. And that was a norm. You didn't have to do anything. They just poured into your clinic because there were so few and far between. Now, from what I understand, to get 20 to 30 a day is already pushing it. All right. So now you realize that the most important thing is to retain what you have. And for those patients that you have retained, hopefully they will introduce you to their friends, to their family, and to their children so that you can again grow your patient base again. Now, reminder definitely will bring in your recurrent income because, like as I say, who is actually contacting the person to come back in 6 months to a year, because in a year it's very, very difficult for your nurse to remember. So here, Teleme automates it completely so that your nurse will be notified that that person has been notified, and there's a tracking. So you will know that this person comes back in. And when you do send a reminder, you can actually write exactly what you want this person to have done so that your nurse will get those things ready. And that's very, very important, because a lot of the times we ask patients to come back in a year's time, we will actually forget what they're coming back for. And I'm guilty of that as well. So I have to write down that this person is coming back for visual field, for OCT retinal scan. So then when my nurse looks at that, they actually get that done before I even come into the clinic. So it's very, very efficient. And it also brings in a lot of recurrent income for this screening kind of patients. The most important thing is I was very sad to have seen some clinics being, sold for 40 to 60,000 after many years. That broke my heart. I realized that they didn't understand about business. In valuation your prior practice, right, it is very important to show the person or whoever's going to buy over your active patient list. And when was the last time they were there, they came to see you, and how much they spent? Because this will be a reflection of your prior practice when you do sell it during your retirement. It is so important. And that is the reason why you must be bothered to connect with your patients. Because lastly, there are now online platforms now out there to get your patients. We have things like the onlinehospital.com, the onlinedoctor.coms, and the onlinepharmacy.coms that are, advertising everywhere. So, you either have to arm yourself with, some kind of online digital platform, or you're going to really not move on with the times. And I hope this has been useful seminar. I really like technology, and with Dr. Allen, we really wanted to improve healthcare. Today was purely about your practice, about how you can improve your patient's healthcare, and most importantly, is how to also improve your private practice at the same time. And with that, thanks, Alan. I hope this has been quite useful. Can't hear you, Alan.
Sorry, forgot to unmute myself. Senior moment, as you said, we're not getting younger, so we need digital tools because that's our peripheral brain, and a lot of reminders, not just for patients but for ourselves. Just a bit of clarification. Hon Bing is the chief of Teleme. Myself, I'm a user of Teleme, and I actually have seen how it's grown. And I think, as you said, it's not just remote consultation, but to me, you've done a great job in digitalizing many aspects of healthcare, patient education, communication, not just between patients and doctors, but between doctors in the referral system, and it's very impressive. There are two apps though. One is for patients and one is for doctors. So I think there's just a distinction there. What you showed was actually the patient app. But I like the way you package things like patient journey, and the patient can actually look and track at things what you actually put for the patient. So it sort of guides them in their healthcare journey. So if you want to get onto Teleme, it's free to sign up. And I put a sign up link in the YouTube description. So actually, all Malaysian doctors, you're welcome to click and sign up and get in touch with Hon Bing if you want to know more or get into get your online presence. As Hon Bing says, I think the brick and mortar shops have becoming extinct and going to be replaced by online shops. So if a brick and mortar GP thinks he will, survive in the 21st century, you've got to have some form of online presence. But what sort of online presence and how, I think we need to talk a little bit more. And I think we have a lot of communication tools nowadays with our smartphones, and I think WhatsApp is very popular. Yeah, I just want to share something. The Ministry of Health is redrafting telemedicine guidelines, and I was just going through the draft, and I just want to share something with you guys, whether you can see it or not. But it says basically they're going to prohibit use of social media like WhatsApp, Facebook Messenger, and all that. So doctors will be prohibited from using WhatsApp for teleconsultation because it's not secure, and in terms of what data can be shared and so on. So I think that's something we really need to move away from. But I think we could use messaging for non-consultative purposes, just general communication. But I just want to say, in my life, I'd like to separate my personal life from work. So you could have WhatsApp for your personal communication, and you could have WhatsApp for general work communication, but not teleconsultation or providing healthcare advice. I think you can do that. Either you have a separate mobile number, or what you could do also, if you use WhatsApp Business, which is a separate app from WhatsApp, the normal WhatsApp, you could actually link that to your landline, which could be your clinic phone, for instance. So that's actually what I do. And if you want to know how to do that, I've linked a talk I gave earlier, which is WhatsApp for doctors, and the link is in the video description below as well. What do you think, Honbing? Do you think the ministry is a little bit too strict by prohibiting teleconsultation by all these social media platforms? They're popular. They're just
Yeah,
very
thanks.
popular.
Thanks. Can you hear me? Yeah, I'm actually on the sandbox. Teleme is one of
Yes.
the they chose about 20 healthcare platforms to represent the community, and we are one of them. We are also approved by Lembaga Pharmacy for our e-prescriptions. So that was very strict. There are only two companies that have that as well. Now, what I didn't tell you, that when you actually sign on, why is it very strict? Because I have to give you a digital signature. An electronic signature is one of those that you would sign like a DigiCert and things like that. Okay, I mean, anybody could have signed it, you see, and no one can actually validate it. A digital signature is very different. We can only use 4 companies that are sanctioned by MOH and the government, and we are using Trustgate. And what happens is, for us to set it up for you, it take about maybe 5 working days, and you will need your IC, we will need your MBBS, we need your APC, and you need your clinic license. If it's not a clinic license, it'll be something like hospital SJMC to prove that you're actually working there. Then we submit that. Then after usually 5 working days, then they will give you the Trustgate digital signature, which is actually in the form of a PIN. Okay, and then from then, anything you sign here will bear that signatory. That is very important for e-prescription. And that's also if you wanted to sign a referral letter. At the moment, the referral letter is signed using the electronic one. Something that you upload from yourself. So because it's already got a password there, it's already considered secure. But for e-prescription, Lembaga Pharmacy doubly sure to make sure that it is actually the person who says it is. So we've done that as well. Now, why did they move away from the social media? I'm afraid it came from that the bogus dentist that was in the Facebook. Okay, it came from that. Okay, so you must realize that Ministry of Health also try to mitigate all this, but it cannot stop people from advertising their jamu and all those things that are not governed by NPRA, which is the Lembaga Pharmacy, and not governed by MMC, because that person's not a doctor, right? He can sell anything. But the Lembaga Pharmacy managed to get Shopee and Lazada to stop selling Panadols and things like that if they are not a legal pharmacists. Okay, so you can see there's a chop there from NPRA, which is very, very good. A Malaysian Pharmaceutical Society. So they managed to come to agreement with Shopee and Lazada that they cannot allow a member of the public to sell pharmaceutical medication. So they've gone one there already. So that's really, really good. So
We have
now,
a question. Sorry, Honbing.
why Facebook? Facebook,
Yeah,
right?
yeah.
Alan, it may be your Facebook, but you've been hacked. That's the problem. And then
Yes, exactly.
masquerade as you, and that's the problem. Now, even with WhatsApp, it can be dangerous because since there was a breach the last 2 months, have you all noticed that there's been people calling you, sending you WhatsApp messages, right? Those are scammers, those are betas, and for you to click onto something that will attack your phone. So that's why the MOH also, that's why they ask you not to use WhatsApp. Because for example, let's say on our platform, we are tied up with a payment gateway. We can actually allow the doctor to actually send you a bill. Let's say you wanted to send your nurse to go and do wound dressing as a GP. So instead of the nurse going there and they say, oh, I never called you, and then deny that, you will send a bill first. You send them a bill. They will pay online. Once they pay, Teleme automatically gives the patient a receipt. You will get back the same copy of the receipt of the invoice. Then only you send that nurse there. All right. We make sure everything is really secure there so that you get your money and that money is safe with you. And therefore, we also please MOH and MMC to make sure that the person who it is here, let's say it's Dr. Allen or whichever GP, they are truly vetted as doctors in Malaysia and with a valid APC and with a valid practicing certificate. Yeah,
So there's a question from one of our Facebook users. So do you need to register telemedicine in our APC?
Oh, no. Okay. So that's very interesting. Now, what is telemedicine? Actually, the fact, if you look into even the old telemedicine or even the MMC rules, right? A phone call is actually telemedicine. All of us have practiced telemedicine way before. You know, when the nurse calls you at middle of the night and says, hey, doctor, patient ni tak boleh tidur lah. Can you prescribe something? And say, yeah, okay, prescribe Xanax and thing. That is telemedicine also. So we've already been practicing telemedicine without realizing that we have been liable for those things as well. You follow? All right. So therefore, what comes into what we are all worried about is negligence. So remember, Alan, you did one with Rajesh Raya, right?
Yeah.
Yeah. She said yes, it's covered, and PS said it's covered because when you talk to a patient, whether it's on the phone, whether it's through Zoom, whether it's through anything, it is a form of consultation, whether you charge or not. Okay, so it's okay, it's all right, because as long as you don't make an error, we are not asking you to treat online. Remember, I have not said a single thing about treatment or consultation throughout the entire thing. It's purely communication, right? You can if you wanted to teleconsult, but as I mentioned, charges for their teleconsultations here are usually the psychiatrists and the psychologists and the counselors because that's how they normally do it anyway, right? As they say, because without auscultating, without palpation, without thing, the chance of you actually getting anything wrong is quite high, like it's 50-50. But it's up to you. It's how you feel like it. Most of us practice in private hospital. Most of us get called. Alan, I'm sure you do. They'll call you and say, I've got this patient, the blood pressure is this, what should I do? They'll say, okay, give some translate or something like that, right? That itself is also consultation because you haven't gone in to examine the patient. You listen to the nurse conveying to you the blood pressure, the pulse, and the breathing, and you authorize the medication. And in the morning, when you go back there, you signed it, correct? Right?
Yep.
Let's be honest
Yeah.
about it. So that's teleconsultation as well. We've all done it. We've all done it.
Okay, I just want to clarify. You do not need to mention that you're doing teleconsultation in your APC. Is not required.
No.
But if you are doing teleconsultation, of course, you need a valid APC, and all that is stated in the APC is you need a valid place of practice. Okay,
Correct.
and that's also a requirement for teleconsultation that you have to have an existing place of practice, be it a clinic or a hospital or something, in order to practice teleconsultation. The other thing I think we touched on also, you do need adequate medical indemnity. So, I think almost all of them currently, in light of COVID, they do recognize teleconsultation. All your like MPS and the other practitioner indemnity companies, they do recognize teleconsultation. Most of them, I think they don't need you to inform them, but do check with your provider whether or not you need to inform them that you're doing teleconsultation. So there is a question. I'm not very clear what it is about prescribing as a form of treatment and online platforms. What do you think about that, Honbing? About online platforms
What do you mean
prescribing?
by
I
prescribing?
don't know.
What do
Yeah.
you mean by prescribing? Sorry.
Yeah, it's not clear. I think if it's your existing patient and you're managing a non-communicable disease, a chronic one like diabetes and hypertension, and you are doing online prescribing for repeat prescription, I think that is permissible under the current guidelines. You should not be prescribing drugs, the so-called DDA drugs. Okay,
Oh,
and
it's not allowed.
that is
Yeah,
now not allowed under
yeah,
the current guidelines.
yeah. DDA are not
Um,
allowed. Even sleeping tablets are not allowed. Okay, quite strict. Yeah.
yeah.
Antidepressants are not allowed. Yeah, stimulants are not allowed. That was a good question. Let's say, for example, you are endocrinologist and your
Mm,
patient run out of high blood pressure medication, and they doesn't want to come up to your place because they are in their hometown. So
mm,
what do you do? Well, there are two options here. You can tell the patient, "Sorry, I'm not going to write you an e-prescription. Go to the GP or the doctor in your hometown to do it." When he goes to that doctor, he has a problem. He says, "Doctor in KL say that I have to ask you to take the medication." He said, "What medication?" Then he said, "Don't know." That well, it was very awkward for that GP
mm,
in
mm,
their hometown. So here,
mm.
that's why we have the e-prescription here that's approved by Lembaga Pharmacy, is so that you can actually write the e-prescription for your patients because you know what medication it is, you know the dosage, all right, and you know that person has run out. So you're actually doing the patient a favor. So you write it, it will go to their app, and on their app, it will come to the all the list of pharmacists that are near him, and he clicks, and then he will then send that e-prescription there, goes there and pays for it, because the Lembaga Pharmacy and all the pharmacies approve this and they recognize this e-prescription, and the pharmacies also have a digital signature because to for them to come on board, they have to be approved by the Lembaga Pharmacy. Again, they have to send their APC, their degree, their IC, and also their license of the outlet. Yeah. So a doctor that does not have a clinic and a pharmacist that does not have a valid outlet are not allowed to be on Teleme. They may be on other platforms because they hire locums, but we don't allow that. Yeah.
What do you think of those online platforms providing healthcare advice, which is permissible, but the moment they engage in on first consults with people who come in with symptoms and they start prescribing people they've never seen before,
Mhm.
should that be disallowed? That sort of e-prescription. Okay,
Well,
that's a bit contentious, but
contentious.
that's currently happening, I think.
Yeah,
Yeah.
because in
Mm,
that is the one that's going to eat into your practice. That's the one
mm,
that's going to be competing against you. So that's why I say that, to be fair, this Uber for Health, which means Uber for Health means the
mm,
patient find it so convenient. Just click there. It's like, they want a hamburger. They click, look for the nearest burger shop, click there and get a burger sent to their house. Very important for the last 2 years during the COVID period because they can't go out. So in the last 2 years, they want to say, I want to talk to a doctor, but my doctor not online work. So I don't click there. Then
mm.
one doctor come and talk to me. I feel so happy. So once they're happy, they stick with this doctor, then you've lost your customer, your patient. All right. So this is what I'm saying is that, so for those restaurants and who are the burger joints who refuse to come on board, they are not going to get their burgers sold right online. And unfortunately, it's as blunt as that. All right, so sad. Yeah. So for those of us who are listening here, who are in the young period, who've got another half of their career left, consider having a hybrid model, right? Because this is the way that you can grow your practice online and offline, because your younger customers, your patients are all very tech savvy and all are very comfortable using technology. This is how they are. I mean, look at the way you buy your things. Look at the way your children buy things. In my days, my mom wouldn't buy anything unless it touched the cloth, lah, things like that. Our kids just go and buy some T-shirt from Alibaba, and it comes in. Oh, okay, looks nice, and then wears it. It's amazing. So we are dealing with this new breed, new generation of patients who we need to understand and also adapt to. Yeah.
Yeah. You showed your. I just want to share another digital tool which I've been playing around with in the last few months. Which you shared your contact or business card where you made edits on the piece of paper, scratch
Yeah,
out or
yeah, correct,
blanco
correct.
and so on. My interest currently, because it's a little bit of hobby, and I'm trying to share with the Dobbers, is getting a virtual card together with a smart card, and this way you can get changes which can be made virtually. It's similar to Teleme, which is more than just a contact card. But if you just want a simple contact card, you can do that. You can make it yourself if you want, but we have created the tools to do so. I just want to share one example of Dobber. Okay, you can see his virtual card there, and you can actually put some branding, whether it's your hospital or clinic. Inform the patient your clinic hours, and then your contacts, which could be your office line, email, WhatsApp. Of course, WhatsApp not for teleconsultation, but just for general communication, some emergency info. You can even, if you're on Teleme, you can even embed your Teleme link there to encourage your patients to sign up. All right. So that's a very elegantly designed virtual card, which works with the smart card, which is also very nice to carry around because it's your branding, and you tap onto the person's smartphone and the virtual card is transmitted over. And when you transmit it over, you can save it as an app on the home screen. Okay, so the patient, you are actually literally residing on the patient's phone, and you always easily call it up. Okay, so if you want a link to how to get this sort of thing, it's in the video description itself. The digital tool, of course, all of us have today is our smartphone, and I think that's where probably about 30% of my brain resides. It's my peripheral brain. I mean, it started 2000, in the year 2000. The turn of the 21st century was this.
Yeah, I
Uh,
still remember that, Alan.
yeah,
You
still,
were the first
sorry.
Palm
I'm
Pilot.
sorry.
You were the first Palm Pilot.
Yeah, that's a Palm Pilot. If you can see that, yeah. That was a PDA, a personal digital assistant. At the time, it wasn't very connected. Maybe you could connect to your phone and then get GPRS and very slow data. Then the first smartphone came out, and that's before Steve Jobs. Yeah,
Oh,
before Apple. That's a Trio. The Trio was the first phone made by a company which was taken over by Palm eventually, and that combined the PDA with the phone. Okay, unfortunately, they ran out of runway and died out, and then they were taken over by Apple. Okay, and the Android devices, which are very much part of our lives today. And I think to me, the digital tool, which is still very important, is our smartphone. So do make use of it. It's not just to make calls and texts, but it has reminders there. I make use of it to remind me to trace results, etc. It has notes there. I used to use things like Evernote and whatnot, but I think I use the Apple Notes. It's just as good, and it's your peripheral brain. Okay. If you're on Android, you can use Google Keep or Google Tasks to help you remember what to do. Okay, just organize your life. Aside from that, you can actually run apps which are specific, like uh, a drug database, okay, or medical references, calculators, and so on. So it's much, much more than just a phone or a communication device, but it's your peripheral brain. So that's my main digital tool for the 21st century. Of course, it combines with telemedicine apps like Teleme, okay, and I use sometimes for video consultation, the hospital SGMC Telehealth Plus, or my DoxyMe, which is I subscribe to a US video consultation service. But these are the things which I've covered in the, but how you do that, it should actually conform to current guidelines. And I think they're always evolving, so be mindful of that. So we watch out for the latest OHS or online healthcare services guidelines coming up from the MOH pretty soon. So I think that's in draft and being evaluated by the stakeholders. So be mindful of what you can and cannot do. And I just alluded to you should not be using social media messaging like WhatsApp, Facebook Messenger, and so on. So I think you should move away and think about getting on the secure platforms like Teleme. Okay, so sign up. The link is below. Okay, it's free to use. If you got any other questions, we are happy to answer you. If you have questions about how to get a online presence, how to actually, digitalize part of your practice as well. I think the future doctor, the purely brick and mortar doctor will die out. I think if you do not have the digitalization as part of your healthcare practice, you will lose out in a big, big way. Do you agree, Honbing?
Yeah, unfortunately,
Yeah.
I realized that. In fact,
Mm.
the next wave is really you got to really communicate with your patients. It's very straightforward, you know. If your patient has a lifetime value, and to you, and it's your also our obligation to make sure that they're healthy for the rest of their life. And if and that's what medicine's all about, to be able to look after them and keep them healthy. It's one of the our very very honored to look after them and be hopefully
Mm.
sometimes be their friend as well and confidant and watch them grow and watch their kids grow up. So part
Mm.
of it is basically service. In those days, it was just a phone or just meeting them in the supermarket and this. Nowadays, you have this app, and basically they're going to spend their healthcare money with you, and we are should be very privileged to be able to be thankful to be able to earn um, our our money to for our kids and things like that through the through looking after them. So we should feel obliged to also give the tools for them to be able to communicate with us and keep them close to our heart so that we can also keep looking after them. Don't lose our patience because now, like as I said here, we've got plenty of other Uber type platforms who are going to go and steal these patients away from us, and we don't want to encourage that. We don't want medicine to be completely commoditized. There must be some form of professionalism inside, and it is up to us. So we mustn't say why bother to connect with our patients. We have to. It's our obligation. It is our duty, and also we enjoy looking after them. So don't put that bother. I know a lot of us are busy. You can always put the nurse as the frontliner. Being
Mm.
able to get a message back within 3 or 4 hours, they appreciate that. They don't expect it within 5 minutes. Right? That's all I can say.
Yeah.
I mean, it's just like now, all our PTAs is done online with our teachers. Last time we had to go all the way there, right? Since the COVID. Now,
Mm.
after that, we still have communication with the teacher. They are very happy to talk to us once a term about how our children are doing. I appreciate that. That's a hybrid school. I don't have to go to school anymore. I can monitor that.
Yeah.
And also, all the exam paper results are all online for me to view. Wonderful. Wonderful. See,
Yeah, I think what the COVID pandemic has taught us how you cannot, the patients who are isolated are in trouble. They need our help, and there was no other way. They were blocked by interstate travel problems. They had no access to medical advice or what to do. The medicines are running out.
yeah,
Their disease is going out of control. They have no idea. So if you and I found that in the last 2 years, the telemedicine has actually really taken off.
yeah,
Really taken off, and I think it's taught us big, big lessons that without some online presence, at least as part, it's not going to replace your practice. It's
yeah. It
just
won't
going to
replace.
supplement. I think a lot of people are very afraid of it. There's nothing to be afraid of. It's just not going to replace it. It's still just going to be a part of it. It's not going to be for every patient. It's just some patients will find it good. Some patients will not want anything to do with it. They still want to come and see you in the clinic, but at least have that service, because if not, then I think, as Honming is alluding to, we are not reaching out well. I mean, to our patients and ensuring a more comprehensive healthcare for them. On a similar note, also the other thing which has made a lot of difference, I find, in at least because in my experience, in where I am in hospital based, we've moved from paper records to over 6 years now to electronic medical records, which are, I think, some of you may have a love-hate relationship with electronic medical records, but they are here to stay. I think there's no way we're going to run about it because it's all about data. It's all about retrieving data and completeness of data entry. If you are clinic-based GP and imagine my sister-in-law is also a GP and she was they were looking for a solution during the pandemic because the clinics were closed, patients were trying to read out, but their records were paper-based. So how are you going to retrieve it? If you are from home. So a cloud-based electronic medical record is best because you can access it from wherever, and you don't have to rely on going to your clinic to retrieve it. Even if it is a computer-based one, it may be standalone and you can't access it unless your clinic is open. What about middle of the night where you urgently need to look up something? There are a number of them available. I put a link to one of them in the video description as well, so you can. And the nice thing about when you subscribe to these electronic medical records, which are online, is you don't have to worry about software updates, maintenance, your computer crashes. It doesn't matter. You just get another device, connect, and then you're back on. So I think that has been a real boon for us. And if the emergency room calls me in the middle of the night and tells me, "Oh, we saw this patient 6 months ago," uh, you know, again the gray cells are decaying. So how am I going to remember about this patient 6 months ago? I just have to whip up the iPad and then look up, and then I can talk meaningfully with the emergency room and medical officer, and then we can have a more meaningful conversation about the patient's healthcare. So all these things have changed the way we practice, and I think we have to get away from a disconnected brick and mortar practice. Everything is connected. We are using all sorts of digital tools with the aim of not replacing but enhancing our current medical practice. So I think we've taken up an hour. I hope you enjoyed Hon Bing's mini presentation about his fantastic platform, which actually has enriches your clinic practice. So do sign up and check it out. It's free for you to sign up and check it out, and then try to connect with your patients this way. Don't be just standalone brick and mortar. The world is changing. Any last words from you, Hon Bing, and where can they find you?
Sorry, it's not free. There's subscription.
Subscription. Yeah, it's moving to that. I mean, even if our advice is not worth anything, it costs money to provide platforms. So there is, but it's free to sign up, isn't it?
Yes, sign up.
For
Yeah,
time
cost
being,
to
yeah.
sign up. Yeah, because it costs money for us to get you your digital signature. Yeah. So don't worry. Because at the end of the day, it will propel your practice. You'll make your practice more valuable without doubt.
Yeah.
Just reach out. I mean, even if it's just a chit chat, on Dobbs or something like that. It's because at the end of the day, everybody has been working in silos and actually don't realize that other industry have really gone past us. I keep in touch with all the digital tools in other industries in e-commerce. E-commerce is always the fastest, fintech and e-commerce, because there's a lot of money in there. So all the best, brightest ideas go there first because the money, the sales are big, you see. So I always like to see what they're doing that I can borrow and into healthcare. Yeah. Okay, thanks.
Okay, so I think we've taken up an hour of your time. So thanks to all who are watching, and we hope we've shared things which will pique your interest if you're not got into the digital healthcare space. And we'll see you again in another session. So we bid all of you good night, and have a great weekend ahead. All right. Good night.
Happy full moon.
This is Mid-Autumn Festival.
Yes,
So
festival.
the actual Mooncake Festival Day. So happy Mid-Autumn Festival to all those celebrating. Yeah. Okay. Good night. All right.